Welcome to the third of 6 podcasts in the series Helping Patients and Caregivers Take the Next Step in Care, Medication Management. In this podcast, Medication Management, CMS NSICV 2011C, Susie Butler and Carol Levine will explain the importance of medication management for patients who transition from one care setting to another. This podcast is produced as a partnership between CMS and the United Hospital Fund's Next Step in Care campaign.
If medication reconciliation is making a roadmap, medication management is driving the course. Even in highly structured environments like hospitals and long-term care facilities, health professionals make mistakes in spite of elaborate stocking inventory and dispensing systems.
Hinda Loddick is the Chief of Nursing at the Heartlands Assisted Living Facility where my mother lives. In her career, she's seen lots of ways to dispense medication.
There are multiple ways to administer medications. We use the bingo cards. Some residents use pill boxes, and some other facilities use pillow packs.
Dr. Michael Kim is the pharmacist owner of Grubbs Pharmacy in Washington, D.C. Grubbs has been serving a Capitol Hill community for over 140 years. He has management advice for caregivers and professionals.
When I speak to caregivers, I tell them that the key thing is just organization, especially if they're on multiple medications. It's one thing to be on one medication, easy to keep track of, but especially if you're on multiple medications, it could be almost a full-time job just keeping track and organizing those medications. So I definitely recommend some type of process in keeping track of the medications, what you're giving your loved ones or your patients.
Dr. Andy Lazarus is a community geriatrician in Howard County, Maryland. He is also my mom's doctor, and he has some common sense advice about managing medication in a home environment.
Well, managing medicines is important, especially if there are many medicines having to be taken throughout the day. If you can take all the medicines in the morning or one time of the day, that's the easiest thing to do. And a lot of the older people I take care of, I try to make sure the medicines can be done that way. If it has to be done throughout the day and they have some kind of memory issues, or if they're notoriously famous for forgetting pills, then often I tell their caregiver to give them a call later and just remind them about the next set of medicines. Keeping them in a box, in a cassette, is only good if they remember to open the cassette. So it usually requires a reminder even for that. And if we can keep the medicines to once or twice a day, that's really the best thing. And if we're doing it 4 or 5 times a day, we can just assume it's not going to happen.
If you have access to the internet, there's some very useful tools available from ARP, the Agency for Healthcare Research and Quality, and the National Transitions of Care Coalition, to name just a few. If you visit the nextstepincare.org site, be sure to review these helpful publications for caregivers and providers: the Next Step in Care Medication Management Form, the Next Step in Care Family Caregiver Guide to Managing Medications, and the Next Step in Care Provider Guide to Managing Medications.
And there's one more good piece of advice that Dr. Lazarus offers caregivers who are having a hard time managing in general.
Caregivers, who are often family members, are the ones who are responsible for doing a lot of the work of people when they get older. Problem often is they feel like they need to do too much. They sometimes step on the toes of the people they're caring for. They feel guilty about anything that goes wrong. What I tell most caregivers is they should help their parent or loved one as much as they can. Explain things to them, write things down for them, but don't be overbearing. I think when they get overbearing, often their loved one reacts the wrong way and does just the opposite. And they shouldn't feel guilty about not being there all the time. They need to realize that they're human beings too, and they can't be completely absorbed in caring for their loved one. So they need to accept the reality of the situation. They may need help, and if they do, they should get it. And I think that's good for everyone when that happens.
Here are some websites you may want to visit if you're looking for help. AskMedicare.gov, maintained by the Centers for Medicare and Medicaid Services. The Administration on Aging's Elder Care Locator. The Aging and Disability Resource Center Technical Assistance Exchange, and Easter Seals Disability Services.
Do you know? What are the 3 most popular methods of dispensing medication in an institutional setting? Internet resources for medication management. Internet resources for caregiver help. Thank you for listening to this CMS podcast. You may also be interested in the other podcasts in the Next Step in Care series: medication risks during transitions in care, medication reconciliation, monitoring compliance, help with medication costs, and caregivers and medication management. The information you heard was correct as of the date it was recorded, July 28, 2011. This podcast isn't a legal document. Official Medicare program legal guidance is contained in the relevant statutes, regulations, and rulings. Thanks for listening.